You think those slight color changes or ridges on your fingernails are just a normal part of getting older? You think your nails are a cosmetic detail, something to trim, to polish, and to forget about. But if you are over 60, your hands might be quietly screaming about a deadly internal crisis happening right now inside your body that you cannot feel yet. I'm Dr. James Cole. I have spent decades watching patients walk into my office with symptoms they should have caught 6 months earlier, and in case after case, the warning was already written on their hands. Kidney disease, heart valve infections, lung cancer, melanoma, all of it, visible on the nails, dismissed as aging, ignored until it was almost too late. In this video, I'm going to show you 8 things your nails are telling you right now about your heart, your kidneys, your liver, your lungs, and your blood. 8 signs, 8 diseases. And I am going to give you the exact hands-on test you can do in the next 20 minutes, right where you are sitting, to find out if your nails are waving a red flag. Let's begin. Before we get into the signs, I need you to understand one thing. Your fingernails are not just keratin, they are a living archive, a 6-month visual record of everything happening inside your body. Every organ under stress, every protein level that dropped, every blood vessel that ruptured, every circulation crisis, all of it leaves a mark on your nails. Your body has been writing this report for months. Most people never read it. You are about to. Hold your hand out right now. Natural light if possible, but any light will do. Look at the color of your nails. Not your polish, not the tip, but the main body of the nail itself. A healthy nail is mostly pink. Not deep red, not brilliant, just a consistent living pink. Now I want you to look for something very specific. A nail that has gone almost entirely white, not just light, white, milky, washed out, like someone drained the color completely out of it, leaving only a very thin strip of pink or reddish color at the very tip of the nail, right where it meets the free edge. The rest of the nail, the entire body of it, the nail closest to your finger, is pale as chalk. That is the first sign. And what it signals is one of the most dangerous things I will discuss today. That color change happens when the small blood vessels in your nail bed begin to compress and lose blood flow. The body does that for a reason. When the liver is under severe stress, when heart function is deteriorating, when kidney disease has progressed far enough to affect fluid and protein levels throughout the body, the circulation to peripheral tissue begins to change, and your nail bed shows it first. I need to tell you about Arthur. Arthur was 71 years old. He came to see me not because he thought he was sick. He thought he was fine. He came because his daughter noticed something at Thanksgiving and would not let it go. She had been watching a health video, and she remembered something about pale nails, and she looked at her father's hands across the dinner table and felt a cold feeling she could not explain. She told him he needed to go in. He argued with her for 3 weeks. He finally went. When I examined Arthur's nails, the pattern was unmistakable. The entire nail plate white, with that narrow rim of color at the tip. When I asked him how long his nails had looked like that, he shrugged and said as far as he knew, always. That told me it had likely been months. We ran a full panel. What came back was not mild. Arthur had early cirrhotic changes to his liver and a depressed ejection fraction that pointed to congestive heart failure beginning to develop. Neither condition had produced a single symptom he had connected to illness. No pain, no significant fatigue beyond what he chalked up to age, nothing. Arthur's daughter saved his life at Thanksgiving dinner. She looked at his hands. Now look at yours again. The full nail body mostly white, thin rim of color only at the tip. If that is what you are seeing, take out your phone right now and photograph both hands with today's date visible. That photograph is the beginning of a medical document. Bring it to your physician this week, not next month. Do not wait for a symptom. The nail is the symptom. Keep your hands out. Look at the same nails, but look for something different this time. Is there a horizontal dividing line, a visible border, running across the nail somewhere around the midpoint? And on one side of that line, is the nail pale, washed out, almost beige? And on the other side, specifically the tip half, the half farthest from your finger, is the nail noticeably darker, deeper pink, brownish, almost the color of a bruise that has faded? That is a two-tone nail, half pale, half dark, a clean split. I need you to understand exactly how this is different from what I just described, because the distinction matters enormously. In the first sign, the entire nail body is white, with just a thin rim of color at the tip. In the second sign, the split is roughly equal. Pale base, dark tip. Same area of the body driving both, but completely different diagnosis. This pattern is one of the strongest visual signals your kidneys can send. When kidney function deteriorates, filtration drops, waste accumulates in the blood, and the circulation to the nail bed changes in a very specific way that creates this two-tone appearance. It can appear months, sometimes a full year, before any conventional kidney symptom develops, before swelling in the ankles, before fatigue you would associate with organ disease, before any blood test your doctor routinely orders flags anything unusual. I had a patient named Carol, 64, retired school teacher, came in for a routine blood pressure check. While she was in the room, I looked at her hands out of habit. I saw the two-tone pattern across 4 of her 10 fingers. I asked her if anyone had ever mentioned her nails. She said no. I asked if she had noticed anything. She said she thought it was just how her nails looked. We added a kidney function panel to her labs that day. Creatinine elevated. GFR significantly below normal range. Stage 2, chronic kidney disease. In a woman who had no symptoms whatsoever, no pain, no swelling, no change in urination she had registered as significant, nothing except what her nails were showing anyone willing to look. We built Carol a management plan immediately. Dietary changes, medication adjustments, regular monitoring every 90 days. She is still in stage 2, she has not progressed, and because we caught it early, that may be where she stays. Look at your nails right now. Pale base, darker tip, a visible dividing line across the nail. If you see this on even one finger, you need a kidney function test this week. Not in 6 months at your annual checkup. This week. Call your doctor tomorrow and tell them you want a creatinine level. Tell them why. Show them the photograph. For the third sign, I need you to look a little differently. Do not look at the surface color of the nail. Look through it, at the tissue beneath the nail plate itself. Tilt your hand slightly toward the light source. Do you see any white lines running horizontally underneath the nail? Pale bands, parallel to the base of the nail, crossing from one side to the other. There might be just one. There might be 2 or 3 of them stacked. Now here is the test that confirms it. Press gently on the nail with your opposite thumb. Apply a little pressure. Watch the lines. Do they disappear when you press, and then come back when you release? If they vanish under pressure and return when you let go, those are not ridges on the nail surface. They are changes in the blood vessels beneath it, and that specific pattern has one primary cause: dangerously low blood protein. Specifically, the main protein your liver produces to regulate what stays in your blood vessels and what leaks into surrounding tissue. When that protein crashes, these pale bands appear in the nail bed. What causes it to crash? Liver disease. Kidney disease causing protein to spill into the urine, serious malnutrition, severe inflammatory illness. The range is significant, but every item on that list is serious. Here's the part that makes these lines particularly valuable. When the underlying condition is treated and protein levels return to normal, the lines fade and eventually disappear. They are not just a warning, they are a live status indicator of what is happening in your bloodstream right now. White horizontal bands visible beneath the nail plate, bands that disappear under gentle pressure and return when you release. Ask your doctor for a serum albumin level. It is a simple blood test. It costs almost nothing, and it is almost certainly not on any routine panel ordered annually. You will need to ask for it specifically. Tilt your nails toward a direct light source now. A window, a lamp, a phone flashlight held at an angle. You are looking for something that resembles a tiny splinter trapped just below the surface of the nail. A thin line, dark, red, brown, or near black, running vertically under the nail plate, like a sliver of wood that got under the nail and left a mark. Now here's the critical thing I need you to understand, because this sign has one feature that makes it either harmless or extremely dangerous, and that feature is location. A dark line near the tip of the nail, up toward the free edge, is almost always the result of minor trauma. A bump, a scratch, a small impact you may not even remember. Ignore it. It is almost certainly nothing. A dark line near the base of the nail, close to the cuticle, close to where the nail emerges from the skin, that is a completely different story. Look at each nail one at a time. Do you see dark lines at the base of multiple nails, 2 fingers, 3 fingers, more, with no injury you can clearly account for? Multiple base of nail dark lines on multiple fingers simultaneously is how bacteria on infected heart valves announce themselves. This condition happens when bacteria colonize one of the 4 valves of the heart. Fragments of infected material break off, travel through the bloodstream as microscopic clots, and rupture the tiny capillaries in your nail bed. The blood spreads in a line. Your fingernail just recorded a cardiovascular event. I want to tell you about Robert, 68 years old. He came in for a completely unrelated issue. He thought he had a recurring sinus infection. While I was reviewing his chart, I noticed he had mentioned some mild fatigue and intermittent low-grade fever in recent weeks. He had attributed the fever to his sinus problem. I asked to see his hands. He had dark lines at the base of 3 different fingers. I asked if he remembered injuring his hands. He could not recall anything. I asked about the fever timeline. It had been going on longer than he realized, closer to 5 weeks. I told him we were not treating a sinus infection that day. Robert had a confirmed heart valve infection, caught before any significant valve damage occurred. The treatment was long and required hospitalization, but it worked. The outcome was very different from what it could have been if we had treated the sinus infection and sent him home. Multiple dark lines near the base of multiple nails, no injury history. That is a same-week medical visit, not next week. This next sign requires both hands and about 3 seconds. Take your 2 index fingers, bring them together, nails touching, the nail surfaces pressed against each other right at the point where the nail meets the skin at the base. Press them gently together. Now look at the gap between them. Look for a small diamond-shaped window of light between the 2 fingernails. A tiny opening at the base where the nails curve away from each other, and a gap appears. Do you see that gap? That small diamond window? That is a healthy result. Your nails have a natural outward curve, and when pressed together, that gap forms naturally. Now look again. Is there no gap at all? Are the nail surfaces pressing completely flat against each other? No window, no light passing between them, completely flush? That is clubbing. In early clubbing, the tissue beneath the nail thickens imperceptibly, and the nail begins to curve downward over the fingertip. From the outside, at a casual glance, the nail looks completely normal. You would never notice it unless you did this exact test, and most people never do. When that gap is absent, the list of conditions associated with it is not a list you want to be on. Lung cancer, in approximately 1 in 3 adult cases of unexplained clubbing in older patients. Pulmonary fibrosis, chronic heart defects, liver cirrhosis. No diamond window between your index fingernails means a chest x-ray and a pulmonary function test at minimum. Schedule that appointment this week. Go back to the test from the very beginning of this video. Do it right now. Press your thumbnail firmly against the pad of a finger until the nail turns white. You have pushed the blood out of the nail bed. Release. Now count out loud. 1, 2. Did the pink slam back in before you finish counting? That is normal. Blood returned fast. Circulation is doing its job. Are you still looking at a pale or white nail at the count of 2? Still pale at 3? That is impaired capillary refill. Blood is not getting back fast enough, and in someone over 60 that has a short list of explanations. Peripheral arterial disease, meaning the arteries supplying blood to your extremities have narrowed significantly. Heart disease with reduced cardiac output, or severe anemia. Now, while your hands are out, look at the color of your nail beds in natural light. That tissue underneath should be a clear, consistent pink. Not pale, not beige, not almost white. I want to tell you about Dorothy. 72 came in because she was feeling tired. She had been feeling tired for 7 months. Her primary care physician had told her twice that her energy levels were consistent with her age. When I saw her nail beds, I understood immediately why 7 months of fatigue had been dismissed. Her nail beds were almost colorless. Her capillary refill was 3.5 seconds. Dorothy's blood work showed severe iron deficiency anemia, hemoglobin dangerously low. We investigated the cause and found gastrointestinal blood loss, slow, chronic, invisible. A condition that could have gone years without discovery if we had kept telling her she was just tired. Pale nail beds plus a capillary refill over 2 seconds, a complete blood count, and a cardiac workup. Both. This week, look at each nail individually now, one at a time. Do you see a stripe running from the base of any nail all the way to the tip? Dark, brown, black, or very dark red, running in a straight line from cuticle to free edge. Now I need to give you important context before I tell you what to watch for. In people with medium to dark skin tones, a single clean, narrow, evenly colored, clearly defined stripe can be entirely normal and may require nothing beyond periodic monitoring. But what I am about to describe is different. And this difference can be the line between catching one of the most lethal forms of skin cancer early, when it is surgically curable, or late, when it is life-threatening. Here is what danger looks like. A stripe that is wider than a standard pen line, edges that are blurry, uneven, or smudged rather than sharp and clearly defined, color within the stripe that is not uniform, darker in one area, lighter in another, and the most critical sign of all, pigment that has crept beyond the nail. that has spread from the nail plate onto the surrounding skin of the finger, onto the cuticle, onto the skin at the base of the nail. Pigment that has escaped the nail entirely. Any single one of those 4 features warrants a dermatology appointment this week, not this month, this week. Caught early, this cancer is surgically curable with excellent outcomes. Caught late, the survival statistics change dramatically. The stripe looks the same at both stages. The timing is everything. Yellow nails. Almost every patient over 60 who walks in with this has already self-diagnosed. Fungus. And sometimes they are right. Fungal nail infection does cause yellowing and thickening. But I need you to pay attention to what I'm about to say, because this is one of the most important distinctions in this entire video. Count your nails, all of them, fingers and toes, 20 nails. If every single one of your nails is turning yellow at the same time, thickening, growing barely at all, with the cuticles beginning to disappear, and at the same time you have swelling in your lower legs that does not fully go away overnight, and you have a persistent cough, recurring chest infections, or breathing that feels heavier than it should, you do not have a fungal infection. Those 3 things together, all 20 nails changing simultaneously, leg swelling, and chronic respiratory problems, are not 3 separate issues. They are one condition with 3 faces. They are your lymphatic drainage system failing. The lymphatic system manages fluid throughout the body, and when it breaks down, it announces itself in 3 separate organ systems simultaneously. 3 different doctors can treat 3 different problems for years and never connect them. I have seen this happen. A patient sees her cardiologist for the leg swelling. She sees her pulmonologist for the persistent cough. She sees her dermatologist for the nails. All 3 are treating symptoms. None of them has the full picture. If you have all 3, bring them to your physician as one connected presentation. Write it down before the appointment. Yellow nails on all 20 fingers and toes, swollen legs, respiratory symptoms. Say all 3 in the same sentence, because that sentence is the diagnosis. Here's what I want you to do from this day forward. Once a month, 5 minutes in natural light, preferably near a window. Before you begin, remove the nail polish from at least 2 or 3 nails so you are examining bare nail. Polish hides everything. The archive is under the color. With bare nails in good light, run through everything we covered today. Hold the nails to the light and observe the overall color. Look through the nail plate for horizontal bands. Look at the base of each nail for dark vertical lines you cannot explain. Do the capillary refill test. Press hard, release, count to 2. Do the diamond gap test with your index fingers. Observe the cuticle line for pigment that has migrated. If you see anything at all, take a photograph with today's date visible. Write down what you see. Bring the photograph to your doctor, because that is exactly what Dolores did. She had been watching her nails for 8 months and she documented what she saw. When she finally got a physician who listened, that documentation told the whole story. Stage 2 chronic kidney disease. Caught early. Managed. Stable. 18 months after her diagnosis, she has not progressed. She may never need dialysis. That outcome exists because she looked at her hands. If you did the nail test at the start of this video, drop the word "checked" in the comments right now. I want to see this community paying attention to its own signals. And if someone you love is over 60, please send them this video. Not because it is interesting, because their nails may be showing something right now that no one else is going to catch. Subscribe, because my next video covers the single most underused blood test in senior medicine. A test that most doctors will not order unless you ask for it by name. A test that can identify cardiovascular risk a full decade before the first symptom ever appears. You will want to be here for that one. This video is for educational purposes only and does not constitute medical advice, diagnosis, or treatment. If you observe any of the signs described in this video, please consult a qualified healthcare professional promptly.